Ms. Jackson. I'm going to be your student nurse for today, and I also reviewed your chart and noticed that you would, the doctor ordered for you to have a catheter inserted. So to begin, I would just like to look at your ID then, if you don't mind. Thank you. Can you please state your full name and date of birth? Okay, thank you. And also, are you allergic to any latex or iodine? Okay, so you are not allergic to latex, but you are allergic to iodine. Okay, thank you for letting me know that, because we will just use hydrogen peroxide instead to clean your perineal area as you're going through the process. So thank you for letting me know that. So before we get started, I'm just gonna make sure everything is in correct order. I'm just gonna move your bed up to a workable height. Okay, as I'm doing that, I'm also noticing the lighting is good for this procedure, and I have a trash bin as well, trash can as well. So with that being said, I'm also gonna have I would have the curtains closed. I'm having the curtains closed. I'm having the doors closed for privacy, and I'm also just gonna have you position yourself, if you don't mind. You are laying down already, which is fine. I'm gonna have you get into a dorsal recumbent position. So I'm gonna have you bend your knees up, have your feet about 2 feet apart. Okay, great, thank you. And yep, that works just like that. So that's for dorsal recumbent position. Okay, now I am just going to clean your perineal area, okay? All right, so with some clean gloves on. All right. I'm going to be getting a cloth and folding it over my hands to clean your perineal area. This is the cloth, okay. I wouldn't have touched it, but this is the cloth, okay? And it's clean, all right. So, okay, now I'm going to hold your perineal open, okay? All right, and I'm just gonna go straight I'm gonna go on the side, down from the top down to the bottom, okay? I'm gonna refold it into a new position. Okay, I'm gonna go down the other side, okay? From top to bottom, I'm gonna fold it into a new position to keep it clean, okay? Now we're just gonna go right down the middle. All right, perfect. Thank you, Ms. Jackson. All right, so I'm just gonna dispose of that into the trash bin. I'm gonna take off my gloves. All right, so we've cleaned the perineal area. Now we could just begin with the process, all right? Okay. So I have gathered my equipment a little bit earlier. I'm just gonna place it on the bed over here. Okay. All right. Okay. All right. And the first thing I'm going to do is take my sterile gloves, put them on. Okay, we don't do this. All right, just fold the cuffs over. All right, now with the sterile drape, I'm just going to fold the corners over my sterile gloves to maintain sterilization for the procedure. And can you please lift up your bottom for me, your hips? Thank you. All right, thank you. Okay, so while maintaining sterilization, I am just gonna open this up to expand the sterile field, okay? All right, and this would be put over a penis, but if we had the appropriate gown-like dressing like this to put over the perineal area of a female, I would address it, I would put it on at this time to cover all the parts of her except for the vaginal area. But in this case, that's for the penis, so we're not gonna use that. But for a female, I would be putting one for a female over the vagina. the perineal area. Okay, now moving forward, here is the tray. Okay. Okay, and here's the catheter. And let me take the cap off. Put it in here ahead of time for the balloon. Okay, and we do not need the iodine, so I'm gonna throw that out. This is my trash bin, by the way, for right now. All right, and then, so I'm gonna fluff the cotton balls. Okay. All right, it appeared to be fluffed. Okay, and I'm going to take the hydrogen peroxide, put it over the cotton balls, douse them. Okay, they're doused, I'm gonna throw that out. And I'm also gonna open the loop since I'm holding it and put it over here for the catheter. Okay. And before I begin to clean Miss Jackson's perineal area with the cotton balls, I'm also gonna take the catheter, place it in the tray where the lube is. Okay, so it's ready for the procedure. Okay, all right. And now I'm going to clean your perineal area, Miss Jackson, okay? Okay. All right. Okay, ready? All right. On the side. Down the side. Down the middle. Okay. And just because I have a few more left. On the side. On the side. Okay. While holding it, I would be placing this in the sharps container as well. That's a sharps container right now. In a real life situation, this would have not fallen out of the tray. This would have remained right here. And since it's already here, I'm also just going to make sure that the catheter is lubricated 1 to 2 inches on the insertion piece. Okay, I have it lubricated. Okay, all right, Miss Jackson, just take a deep breath in. Okay, all right, we're going to be inserting it. Okay, go about 2 to 3 inches in. Okay, rotating it. Continue to go up another 2 to 3 inches. Okay, there's resistance, and it is about that far in. So now I'm going to hold with my non-dominant hand the catheter while it's in there as well, and inflate the balloon. Okay, all right, I'm just gonna see if there's any resistance. Okay, there is, yep, it's in place. Perfect. I would also be putting this in the sharps container as well as the tongs. And now I'm just gonna clean up the procedure. Place your bag here for the moment so I can get that hung. Thank you, Miss Jackson. All right. All right. This is trash, so I would have put it in the trash area. Okay. And now, with that being said, okay. Now that that is in, I would also take the, okay, I'm going to take my gloves off. Okay. put it in the trash bin. I'm gonna, for hand hygiene, okay. I'm gonna don new gloves. These are my only clean gloves. In a real life situation, I wouldn't be taking them off the floor. I'd be taking them out of a glove container. Okay. Okay. All right. Now I have donned some clean gloves. I'm just going to strap this as well to your thigh. Okay, strap to the thigh, and now I am also going to hang the bag over here. Right on the bottom of the bed. Okay, all right. Okay, and then for dignity and comfort again, I'm just gonna make sure you are covered and everything. Okay, Miss Jackson. I'm also just gonna lower your bed back down to a normal height, back down to the bottom. All right, sounds good. I also would have donned fresh gloves before. I would have doffed the gloves and cleaned my hands before doing this, by the way. Put the bed back down to the normal height. Okay, you're covered and everything. All right, Miss Jackson. Thank you. Also, to take a urine sample, I would have done hand hygiene. I would have donned new gloves, and Miss Jackson doesn't need a urine sample taken, but just to show how I would do it, I would, after I did what I just explained, I would take the urine container, and I would take this bag, I would take this part out of it. Okay, it is still closed, and I would be putting this on a clean field, and then to open the urine to come out for the sample I need, I would be pressing this, okay? And that's about as much urine as I need, so I'm gonna push it back. All right. Okay, I would be putting the cap on, and I would be sending this to the lab. So that's what I would do if I wanted to take a urine sample. If when later on Miss Jackson has some urine coming out, that's what I would be doing. With that being said, okay, Miss Jackson, are you in any pain? Do you feel comfortable? Is there anything else I can get for you before I leave for the room, or put in your space before I leave so you don't have to reach for anything? No? Okay, thank you, Miss Jackson. I appreciate it. Have a great day.